What does attenuation mean on your kidney court scan? Imagine looking inside your body with a special camera that shows how different parts of your kidneys absorb X-ray beams. That's what a court scan does. When doctors look at the images, they measure something called attenuation. Attenuation tells us how much the kidney tissue or any abnormality inside the kidney blocks or absorbs the X-ray beams during the scan. This measurement is expressed in units called Hounsfield units. If the tissue absorbs more X-rays, it appears brighter on the scan because it blocks more of the beams. If it absorbs less, it looks darker since fewer X-rays are blocked. In kidney health and kidney cancer, attenuation helps doctors tell different types of tissues and abnormalities apart. Normal kidney tissue has a specific range of attenuation values. When a person has a simple renal cyst, which is a benign fluid-filled sac, it usually shows low attenuation values, typically less than 20 to 30 Hounsfield units on a non-contrast scan. These cysts look dark because the fluid inside doesn't block many X-rays. On the other hand, kidney tumors, including cancers like renal cell carcinoma, tend to have higher attenuation values, often above 40 Hounsfield units when contrast is used. These tumors usually appear brighter because they are made of solid tissue with blood flow, which absorbs more X-rays. Sometimes, parts of kidney cancer can have low attenuation if they contain cystic or dead tissue, which can make diagnosis tricky. The difference in attenuation between the two kidneys can also provide clues. For example, if one kidney shows a difference of 5 Hounsfield units or more compared to the other, it might suggest issues like a kidney stone causing blockage or swelling. Doctors also look at how a kidney mass responds after contrast dye is administered. If the mass's attenuation increases by 20 Hounsfield units or more, it suggests the mass has blood flow and is more likely to be a solid tumor rather than a benign cyst. This measurement helps guide further testing and management. Overall, attenuation is a crucial tool in interpreting kidney court scans. It helps distinguish benign from potentially malignant lesions, assess kidney function, and detect obstructions or other abnormalities. But it's important to remember that these measurements are just one part of the bigger picture. Radiologists combine attenuation data with other imaging features and clinical information to make accurate diagnoses. If a suspicious mass is found, your healthcare provider might recommend follow-up imaging or a biopsy for more definitive answers. Always consult a healthcare professional for personalized advice and interpretation of your scan results.